So Jade, you were letting me know today how there's significant allergy, that we're in a significant allergy season right now.
Yeah. Right now, even today, the mold is really high. People are normally accustomed or thinking of like ragweed or pollen as issues, but mold is another issue that a lot of people that suffer from allergies are, I'm sure, are very familiar with. So I know there's a big issue that we can help address. So I want to talk about it because a lot of people don't know that we can help them out with cupping or acu to help alleviate a lot of those symptoms.
Before we head into treatments, though,
Sure.
let's just talk more about allergies in general, some of the triggers that occur. I mean, everyone is familiar with the pollen count. Even the Weather Channel, they have a pollen count that they monitor, and it's very important that you look at the region because
Yeah.
if you're in one part of the state versus the other, it could be very drastically different.
Yeah.
But we were just talking about how many people don't know about the mold and the different types of mold.
Yeah.
And you were just at a different situation earlier today where people were talking about it.
Yeah. For example, I was out in Riverhead this morning, and I mean, we didn't get a lot of rain recently, and it's usually mostly triggered after the rain. We get a high mold count. But today, if you look at the index, the mold is very high. So people that have sensitivities to that may be suffering from that. And there are options, even in their environment, that could be helpful, like such as getting like a HEPA filter at home or a HEPA filter at their place of work. It can help with filtering out a lot of those pollutants in the air so that they're not suffering so much day to day.
I'm glad you mentioned air filtration. So I don't get sponsored by the company, but I'm a huge fan of the Rabbit Air.
Oh, wow.
It's really an industrial, but it looks like a very nice air filter. It's not those big, ugly, and loud, noisy things, but
Right.
there's 7 air filters in it. It does an amazing job.
Get out.
I've used it for years, one in the bedroom, one in the living room. It works really well. Now, you were just talking about many different types of triggers and more than just pollen.
Yeah.
The biggest thing I hear in the clinic, in the office, is, I'm just not quite sure what's going on. I've never had allergies before,
Right.
but I'm having all these signs and symptoms, and my doctor says I'm not sick. I don't have the flu. I don't have a cold, but I have wheezing. I have congestion.
Yeah.
Probably the biggest one is a runny nose, watery eyes, just even minor puffiness in the face,
Yeah.
eyes, cheeks, nasal passageways, even into the front of the head region.
Yeah.
Even some sinus and headache or headache kind of pressure.
Yeah, especially when they wake up in the morning. Even I've never had allergies, but there are certain times of year or even certain times during the day lately, I wake up and my face feels a little puffy and a little bit of pressure in my forehead, and that's so common. And it's just sometimes the doctor will say, oh, the older you get, the more sensitive you get to different allergies, but sometimes it's just the pollutants in the air are a little higher than usual, and you may end up, experiencing some sensitivity to it.
It's kind of hard to believe, but it's very true that our immune system changes over time. Not everybody, but
Yeah.
stress, our environment tends to sometimes change it. All of a sudden you weren't allergic to anything, but now you have mild allergy symptoms,
Right.
and you're not going crazy.
Right.
Your immune system is just different or changed now, or it's not accustomed to the normal pollutants or the new ones that you're experiencing through your day-to-day life, and now you can be experiencing some of these allergy signs.
Right.
Fatigue is one of the major signs. Fatigue. You may not notice that slight congestion or the headache or something that may not feel so out of the normal, but you have this extra fatigue that you just don't know what it is. You might be confusing it with the after lunch kind of crash,
Right.
but it's not. It's because of the allergies, and you're not accustomed to something.
Yeah, and I'm hearing that a lot. Two people that I see all the time, they're complaining, saying, I don't know, I feel like maybe I have a cold. Like, I'm not getting aches and the typical cold symptoms, but I just, the constant runny nose, and I kind of have a headache, and I just feel out of it. And I was telling you yesterday, someone ended up calling out of work just because they can't take it. Like, the symptoms were just that bad, they stayed in bed. And today,
Wow.
yeah, so it's definitely something that, especially out here where we have so much nature, it's not like, I'm sure in the city there's plenty of allergens to deal with as well, but we get it a lot out here. The mold, definitely high, the ragweed, pollen, all that, and we're exposed to it all the time because there's so much of that in these areas.
I've been hearing in the clinic different times of day. So today specifically, I've been hearing how around 5, 6 o'clock in the morning, A patient was waking up congested. I woke him up from sleep. I don't hear that one a lot, but I do hear different times of day bother people. Just before dawn.
Yeah.
When the body's experiencing fatigue at the end of a workday at nighttime, you might experience different symptoms around the different time of day.
Yeah, I agree. The woman that I was speaking about earlier, she said she was so concerned that it might wake her up in the night. It didn't happen last night, but it's definitely happened to her in the past. So she was just apprehensive about it, and she went out and got that filter today. So she's like hoping that that'll help. And I definitely went over, options that, we could offer, because there's other alternative options instead of just receiving the typical, I think they ended up giving her medication for asthma to cover it instead.
Really?
Because it's that bad for her. So it's like a environmental asthma or situational. So it's something that she'll end up, taking regularly, but maybe not long term,
Probably just for a particular season.
Yeah.
Usually when the cold weather kicks in.
Yep.
But then for some people that brings a whole set of other allergies.
Right.
So for those who are just allergic to the mold and then they don't know it, once we get deep into the winter, that will probably resolve.
Right.
Some people can have allergies all year long, all 4 season allergies, which is really horrible because they have no break for the entire season.
Right.
You were saying just before how you're experiencing some sort of grogginess or stuffiness in the morning.
Yeah.
What are you doing to help alleviate that?
I like getting facial cupping. I feel like it helps the face drain, and I don't like taking pills or medication. I definitely don't want to be on a pump or an inhaler. So, I mean, some people, if they think about it, getting points in the face is kind of scary for them. But even for me, acupuncture, you get some in the face, you get some in the body. It helps drain, and you get for me, I get instant relief.
Now you mentioned a lot of therapies right there.
Yeah.
And a lot of them can be very unfamiliar. I mean, you just talked about acupuncture, cupping, facial cupping, some kind of pump, some medications like Claritin, over-the-counters like that. So let's just backtrack, and I just want to ask you, so you personally alleviate your stuffiness and sinus pressure with facial cupping?
Yeah.
I'm somewhat familiar with that, but can you just give me a rundown of what that's like? Because when I think of cupping, when we think of cupping, we think of those big marks on your back.
Yeah.
So what is that specifically?
Well, with facial cupping, it's much different. It's very light pressure. It's a different style of cup altogether. They're suction, and they're very small compared to what we see. They don't leave marks, and it feels more like a massage than anything else. And they're small, maybe about that size, and we would use them to just create a little suction, light pressure around the face, and open up and drain the sinuses. So it's great.
Because both you and I, we treat fine lines, wrinkles,
Yep.
And any kind of complexion disorder.
Yep.
I'm familiar with the facial cupping, and there are these little a regular cup for the back is like about this big.
Yeah, like.
And the ones that go on the face are really small. We'll get a caption up here. So that you can see what that looks like.
Right.
And the pressure is so light. It really only feels like pressure to the pores rather than a deep kind of pressure.
Yeah.
And there is no redness or bruising.
Nothing.
But those little canals that can get stuffed up with mucus, it really gently pulls it and drains it in 30 seconds or less.
Yeah.
It's extremely helpful.
For me, it's instant relief. Really. For me, it's amazing. I highly recommend it. Of course.
Yeah. Now, another thing that we're talking about is over-the-counters. So we're most common over-the-counters could be Claritin or prescription Claritin.
Yeah.
Now the downside with those is I hear from a lot of patients, it makes them very tired.
Yeah, like groggy after. I mean, you're groggy with the allergies, and then you take the Claritin, and you're still a little groggy. It's not giving you that mental clarity that you're looking for with Claritin.
So I think a lot of advice that I give in the clinic with allergies is sometimes we can't avoid how allergic or sensitive we are to something seasonally. But one of the biggest suggestions I give is having an ultra clean diet.
Yeah.
Specifically during the couple of weeks of that season. So if you can reduce your sugar intake, your simple carbohydrates, really maybe even trying taking the wheat out of your diet.
Increasing your water intake.
Increase the water is always good. Sometimes seltzer or flavored water isn't enough. Sometimes you have to use just just plain old water
Yeah.
to
Yeah.
really help flush that out.
Yeah.
You can even consider intermittent fasting, where you just don't eat as much and you eat healthier foods. In that time, that kind of gets the mucus production of certain foods, like your orange juice and your bananas, even healthy foods. Sometimes the oils and avocados
Yeah.
during while you're already having allergic
Yeah.
response. Sometimes that little bit of even a healthy fat or healthy oil will throw you over the edge just for some congestion, even though it's healthy.
Yeah.
So just reduce the calories, eat clean, eat healthy, and even consider it intermittent fasting.
Absolutely. I agree with that. I mean, there's clean diet any time of year is great, but when you're dealing with allergies, it's definitely something that can help faster than you think. Turn
Have you
things
ever
around.
tried a neti pot?
Yes, I have.
Tell
Neti
me how that worked. What'd you do with it? Did you add anything to the water?
Okay, so the first neti pot I got was like one of those ceramic ones, right? And
Yeah.
it comes with the salt, and you're like, oh my God, salt in my nose. I don't think I can do it. But it's a very small amount of salt. It dissolves in the water, and you don't really feel it going, like when people see a neti pot, they're like, oh my God, water up your nose. I wouldn't want that. It's not like the feeling you get if you're like in the pool. Water up your nose, like that's painful. A neti pot is more, you're not breathing it in any way. It's just passing through the nasal passage, and whatever's in there is going to come right out. It's kind of an interesting experience, but you feel better after. You do.
So I have to agree and disagree with you a little bit. So I've tried it before. I've tried the clay pot. I've tried the plastic pot, which is cheaper.
Yeah.
The way I disagree with you, it does kind of feel like water goes up my nose in the pool.
You might not be doing it right. Really? You just have to lean. If you just lean, you don't feel it.
I don't think it's as uncomfortable, and there's definitely no chlorine to it.
Oh yeah.
So let me just give words of wisdom on how to do it the most comfortable way.
Yeah.
I strongly recommend using spring water, bottled water, or distilled water.
Yeah.
The tap water tends to contain chlorine and other minerals and impurities that can kind of burn a little bit. It's not horrible. It's not the worst. The biggest thing is you can't use regular salt.
Right.
Because it contains iodine, and that also burns and hurts too.
Oh my gosh, did you try that?
No, I didn't.
Oh, I was going to say.
I didn't try that. But I found that out not the hard way.
Okay, good.
Which is good, yeah.
Yeah.
And that's why that little package of salt on the shelf next to it is like really expensive. You're like, what is this? Like salt charged 10 times the price. For a couple $, you get the ultra fine non-iodized salt.
Yes.
And it makes a huge difference. And you're just using just a pinch.
Yeah.
And then you really got to tilt your head to the side,
If without the tilting, you could probably get some backflow and it'd be uncomfortable. But you gotta once you get the flow of it, to me, it's not painful.
Some people feel that they have an easier way with one nostril than the other direction.
Yeah.
Some people can't go both ways.
Yeah.
Which is okay. You really don't need to.
Right.
If you just pick one nostril and it comes out the other side, and everything clears out, you don't need to then go back on the other side and then try and make it go the reverse flow. You can, I guess that's optimal, but you'll still receive 90 more of the benefit if you do it one direction.
Absolutely. I agree with that.
So anyway, if you guys want to be daring, try a neti pot. Get them on Amazon. Watch a YouTube.
Yeah. Instructional videos are helpful.
Or even just watch the YouTube. They're kind of funny.
Yeah, exactly. Oh gosh. I can imagine. First time neti pot, whole scene. Yeah.
Okay, so we talked about diet, we talked about fasting, medications, neti pot, facial cupping. What else can the average person do to help them when they're getting congestion, fatigue, pressure? What can they do?
I would recommend acupuncture. I would. I mean, maybe the average person thinks that's not accessible, but it is accessible.
Are you going to stick points in their face?
I would if they were comfortable with it, but it's not painful. It's not.
It's also not necessary either, right?
I mean, you don't have to, but I find with some cases, if people are comfortable with it, it's instant relief. It's not deep needling, it's not painful, and it's useful, in my experience.
I mean, there are really good points right here to use that really strongly open up the nasal passage without being uncomfortable.
Right.
But there is a lot of body points on the arms and legs that instantly open the nasal passageway.
That's
And
awesome.
even behind your neck region too.
Yes.
That really open up that. So if someone's really struggling, they could try acupuncture,
Yeah.
acupressure. They can do self-massage, maybe on the back of their head and neck.
Yeah.
Um,
Even around the ears can help train,
Mhm.
because a lot of times people suffer with allergies. They have ear things going on too, and there's massage for that, and that's a great option. So, and again, if someone's not comfortable with needles in their face, that's fine. Points in their face, that's fine. Acupressure is great for that as well. So there are options.
Now, what about kids though? Have you worked with kids and allergies?
Yes, I would not recommend points in the face for children. And the less points, the better with children. But kids respond very well to cupping. So, and I highly recommend it. You know, I have a son, so every chance I get, he loves my cupping set, so he loves it. And I never had a complaint, not yet.
I know you specifically specialize in pediatrics and
Sure.
women's health. And so I know you work with children a lot,
Yeah.
and their treatments. Just tell me a little bit about, about children and teens and kind of allergy treatments with
Yeah.
acupuncture, cupping, massage therapy.
Well, I find, again, children respond so fast to treatments. They don't need a long treatment, whereas an adult may be able to sit and relax for a half hour, 45 minutes. A child, you can give them a 15-minute treatment and they respond tremendously. Sometimes the symptoms make it a little bit worse for that first night, and then the next day they clear up, and it's surprising. People are amazed. But it's effective, it's gentle, and they're interested. Young people are definitely interested. Whenever they experience it, it's an amazing experience, and now they have something, new to talk about, and it's great.
Mm-hmm.
Yeah.
So that's interesting. So for kids, they respond immediately.
Yeah.
They get results really quickly.
Yes.
And their treatment is 15, 20, 25 minutes.
Yeah.
Whereas adults, it could be 45 minutes to an hour.
Right.
With kids, it's a few points.
Right. With children, you can't expect them to sit long. So the treatment needs to be effective, short, but they respond very well. Children's immune systems are amazing, and they always usually respond very well to pediatric acupuncture.
Awesome.
Yeah.
All right, I think that covers up allergies.
Yes.
All right.